Doctors of Reddit, what is the most obvious lie a patient has ever told about their health history? Last week in an endocrine clinic, discussing an obese diabetic patient's weight gain and diet, I went through each of her meals asking when and what she eats. Essentially, she told me that she drinks a glass of water around noon each day and that's it. Still gaining weight. My attending, I'm a resident, told me I should have recommended that she drink half a glass of water instead. In all seriousness though, some people can't even be honest with themselves, so it's not worth getting upset if they're dishonest with you. Just keep encouraging them in the right direction. I used to work in X-ray. Sometimes people don't know they're lying. Have you had any metalware replacement? No, they just fixed the bone. Do the X-ray and it's a massive rod in there. And the patient literally had no idea that was there. Or the sadder cases of elderly people who just don't know. You tell them they've had a hip replacement, and they just don't believe you. I worked in a hospital for quite a while, though not as doctor. Normally it isn't lying about stuff deliberately. They are often convinced of what they're saying. For instance, a guy explained to me that it was normal for him to have very high blood pressure because he had it all the time. This is not normal. Going down for a smoke then coming up with a Pepsi and eating is not normal. The doc even told him, "You're not going to grow old like that." Not a doctor, but used to work in an ER. High proportion of patients who are allergic to NSAIDs. When you tell them you'll give them Tylenol instead, "Oh, I'm allergic to that too." Standard, not a drive, but. Back in my drinking/alcoholic days, I was trying to convince multiple hospital staff, post-blood work, that I hadn't had any alcohol. My BAC was 0.50 and I shouldn't have even been breathing. I once had an alcoholic patient with a BAC of 0.72. It was so high that I had to manually calculate it using the measured osmol in the blood because our machines only go up to 0.5. He was happily ghost-stepping around the ER. My diabetic patients, I take my insulin, I eat well, my finger sticks are in the 120 to 150 range while their A1C is 13. My grandma. Stop lying to the doctors and ignoring their instructions, grandma. Take your meds and your treatments before I lose my cause. I love her and want her around for as long as possible. Something has to take you. If you're elderly and diabetic but have a sweet tooth, why not? At the age of 85, my grandmother was told her cholesterol was high and she needed to cut out cheese. She replied to the doctor, "Son, I'm already 85, I'm not going to live forever," and carried on eating as much cheese as she liked until the day she died. I used to do palliative care for an elderly lady, Helen, who had a form of narcolepsy. She slept all the time, and needed somebody to help her at lunchtime because she would just fall asleep at the table and not get any food. She was diabetic, also, and her daughter didn't want her having any chocolate milk, which she loved. Once I was helping her, and she asked for some chocolate milk. I told her, "Your daughter doesn't want you to have chocolate milk." Well, Helen suddenly sat up straight and almost yelled, "Who is she to tell me I can't have chocolate milk?" It was the most awake I ever got to see her. Well, I got her chocolate milk, figuring she was at the end of her life anyway. Why should she be deprived of things she enjoys, considering there are only a few things left to enjoy when you are old and in failing health? The doctors that are dentists are probably thinking I floss every day. Hygienist during my last visit, "So, you know how when you're flossing?" Me, nodding my head knowing full well I don't floss, I told my dentist that I flossed every 3 days. This was true. They told me to do it every day. Next time, I said I did it every day. They said they could tell. Great job. I did not change a thing. I was admitted for pancreatitis once and the doctors and nurses repeatedly asked if I used drugs or was a heavy drinker. No to both. They continually didn't believe me even though I told them to test me. I was in the hospital for over a week without once having any withdrawal symptoms. I know that patients lie, but it's just as frustrating when you're telling the truth and they don't believe you. Even my wife told them several times that I did not drink or use drugs, but they kept saying it's extremely rare to get pancreatitis if you're not a heavy user. I've been hospitalized 3 times for pancreatitis. Because 2 other members of my family have had it, they've decided with me that it's genetic and blood sugar related. But the number of times I'm asked, "How much do you drink?" instead of "Do you drink?" irritates me. Read my file. This last time when the intern started on that path, I replied with, "I'm Muslim and take my faith seriously." I didn't have my hijab on, I was too sick to care at that point. The intern's name was Muhammad. He quit with that line of questioning.